All right. Hello, Jessica. My name is Jennifer Zigrang. I am a nurse practitioner student for Maryville University. This is my head-to-toe video assessment of you. Okay. First of all, we forego the gown, and we're doing these exercise clothing. And do you need to empty your bladder though?
No.
Okay. I'm going to get your height and your weight. You can step on that. It is 140. Go ahead and, yep, to the back. Okay. And you are 5'1". Very good. All right. I'm going to go ahead and get your temperature. And it is 98.4. Very good. And I'm going to get your blood pressure. And you've been healthy?
Mm-hmm.
Good deal. Do you have any allergies to anything?
Sulfa.
Okay, what happens when you have sulfa?
You get rashes.
Well, we won't do that then, will we? Okay. No problems with your blood pressure or anything like that?
No.
Okay. And you're a CNA?
Yes.
So you do this?
Yes. We use the machine.
(118 over 74). Very good. All right. I'm going to go ahead and listen to your apical pulse. And I would normally listen to this for a minute, a full minute. But for time constraint, I'm just going to do it for 15. And that is 78. That is good and strong and even. Okay. I'm going to start off general appearance. You look like you're healthy. You don't have any chronic diseases or anything?
No.
Can you tell me your name and the day and where we're at?
My name is Jessica. It's December 6, 2014. We're at home.
Okay, very good. And it looks like you're well nourished. Your diet is good?
Yeah.
Okay, very good. And I saw your gait was steady. You don't have any problems walking with coordination or anything like that. Okay. First of all, I'm going to take a look at your head and your face and the symmetry of it. It doesn't look like you have any deformities, anything like that. I'm going to do some cranial nerve testing also. So we're going to test the facial cranial nerve, number 7. And if you could do a few things for me. Can you wrinkle your forehead? Can you shut your eyes, squint them? And clench your teeth? And smile? Puff your cheeks out? And can you stick your tongue out? And then wiggle it back and forth? Okay? And that's checking the hypoglossal cranial nerve, number 12. Okay? I'm going to just take a look at and palpate your bones, your facial bones. Any pain at all? Any trauma that you've ever had?
No.
Okay. I'm also going to palpate your sinuses, your frontal, and your maxillary. Any pain with that?
No.
Okay, very good. I'm going to check your temporal mandibular joint. If you can open up. Okay, and close. And open. Big and wide. And close. Okay, and then grit your teeth. And I'm looking for, that's the trigeminal nerve, cranial nerve, number 5 that I'm checking. And that's all nice and good. You didn't have any pain when you opened up your jaw?
No.
Okay, very good. I'm going to do some light sensation now. And this is also checking the trigeminal nerve, okay? Can you close your eyes for me? And you tell me whether it is sharp or
Sharp.
dull. Okay.
Sharp. Dull. Sharp. Dull. Sharp.
Very good. All right. All right, we're going to move on to your eyes. Looking at your eyelashes, they go up and out. And that's the line, I think. Okay. And the sclera is nice and white. I'm going to check your conjunctiva, and it's nice and light pink. It's not too red, and it's not too pale. Okay. Any problems with your eyes? Any matter? No? Good. All right. I'm going to go ahead and do your, check your pupils, your pupillary response. Okay. So if you can just look right here. Okay. And I'm checking the direct, and then the indirect for the other eye, and the direct, and the indirect. Very good. You have, it's nice and equal. They both move the same, and the consensual moves also, just not quite as much. Okay. Very good. I'm going to go ahead and do the cardinal vision field. So if you can follow my finger. Very good. Okay, and then follow it all the way in. Good. All right, and that's checking cranial nerves number 3, 4, and 6. Okay, and that's your abducens and your trochlear and your oculomotor. Okay. So very good. I'm going to do the cover-uncover test now. If you can just look here, okay, and go ahead and take that, cover up one eye, okay, and then go ahead and uncover it, and then cover up the other eye. Okay, very good. And I'm looking for any jumping, and there's no jumping that I can see, okay? So that's very well good. Okay, we'll move on to your ears now. I'm going to look at the placement and the symmetry. And the auricle sits above an imaginary line from your occiput to your inner canthus, and it's symmetrical on both sides. And look behind to make sure there's no growths or anything. I'm palpating your auricle, checking for any nodes or anything like that. I don't feel anything. You can go ahead and check inside now. Okay. And I'm looking for the bony prominences. I'm looking for the patency of the ear canal itself. And I see the right light reflex and the umbo and the handle of malleus. And I'm going to do the other side also. And this is nice, and it's the tympanic membranes themselves are nice and pearly gray. I don't see any exudate. There's no bulging. There is just a little bit of wax in that left ear. Okay. I'm going to go ahead and check your actual hearing. If you can stand up here. And I'm going to have you cover your left ear. And I'm going to say some words, and you tell me which words I'm saying.
Pineapple. Orange. Banana.
Okay, and then do your other ear.
Say what?
Purple.
Purple. Blue. Red. Purple.
Very good, okay. All right, I'm going to go ahead and do the Weber test now. And this is a tuning fork. I'm going to strike it, I'm going to place it on top of your head. And you tell me if you hear it in one ear, both ears, or if there's any difference, okay?
Oh.
Okay, very good. All right, and this is checking for the vestibular cochlear cranial nerve number 8, okay?
Yeah.
All right, and this is the Rinne test. Place this on your malleolus. You go ahead and tell me when you stop hearing it. Okay, and tell me when you stop hearing it. Okay, so it was 8 seconds for your bony prominence, and another 8 seconds for the air, and that's perfectly normal. It should be double. So you did very good. All right, I'm going to go ahead and inspect your nose now, okay? If you will look up, I'm looking at the mucous membranes, if there's any drainage. I'm looking at the septum itself, making sure it's nice and straight, and there's no deviation. The hair, the cilia is evenly distributed. I don't see any drainage or congestion. The turbinates are nice and pink. Okay. Can you go ahead and occlude one nostril and breathe in and out? And the other one. And we're checking for the patency. Okay. Very good. All right, we're going to go ahead and look at your mouth now. I'm looking at the lips, and can you open up? Looking at the tongue itself and the hard and soft palate. Looking at the floor of the mouth. Can you touch your tongue? Very good. And that's a lot of times where oral cancer will be. I'm looking at the lateral aspects of the tongue. It's all nice and symmetrical. The size is appropriate. It doesn't look like it's enlarged or anything. And there's no like pockets of anything amiss, any sores or anything. Let me go ahead and look at your gums here. And your teeth are nice. I don't see that you're missing any. And you've been to the dentist because I can see you have fillings. Okay, now open up really big. Okay, very good. And the soft palate rises. Go ahead and okay, your gag reflex is intact. So, and that's checking the glossopharyngeal and the vagus nerves. Yeah. Okay, cranial nerve number 9 and 10. All right, very good. I'm going to go ahead and look at your neck now, and the symmetry, making sure there's no goiters. It's nice and smooth. I don't see anything that's obviously unsymmetrical about it. Okay. I'm going to go ahead and have you lay back here. And I'm going to check for jugular vein distension. Okay. So if you can tilt your head to one side, please. All right. And I don't see any, there's no JVD at all. And I actually don't even see any pulsations. If I can look at the other side. Very good. And if I do see a pulsation, I would go ahead and time it to the pulse, and it's the same. So very good. All right. And check for tracheal deviations. Okay. And it's nice and symmetrical. It doesn't veer off one side or the other. I'm checking the thyroid itself. And it's good. Okay. I'm going to go ahead and have you swallow. And so I can see. Good job. Okay. And that rises nice. Go ahead and do it again. And I'm just going to palpate. Very good. All right. I don't feel any nodules at all when you swallowed. Okay. So your thyroid feels nice and smooth. And go ahead and check your carotids. It's good and strong. Okay. All right. I'm going to move onward and do your check your lymph nodes, the pre and post auricles along your malleolus there, malleus, and the submandibular and submental, the tonsillar, the superficial cervical, the deep cervical, and the supraclavicular. And I don't feel any swellings, anything like that. I need to do your occipital too on the back. Very good. All right, we're going to move on and do your arms and your shoulders, making sure that it's all nice and maybe kind of be that way a little bit more. There you go. Your tone is nice and good. Your skin is very consistent. I don't see any sores. Hair distribution is even. There's no edema. Nice and warm. I don't see any clubbing on your fingers. And your cap refill is brisk. And both hands. That's very good. And then go ahead and do your radial pulses here too. Your brachial. And radial. And brachial. And radial. Okay, and then go ahead and squeeze for me. Okay, and can you push up? And down. Very good. All right, I'm going to look at your back now. All right. Yeah. Looking at the contour, looking at the respiratory effort, um, it doesn't look, it's very non-labored. You don't have a cough or anything, any problems breathing, Jess?
No.
Okay. Your skin is nice, it's consistent throughout. You do have a little bit of acne. It's nice and I don't see anything amiss. I don't see any like retractions or any muscles, accessory muscle usage. Okay. I'm going to go ahead and palpate your back. Tell me if you feel anything that's sore. Okay. Nothing bad there?
No.
Okay. And I'm going to check for a tactile thermometer while we're at it. Can you say 99?
99, 99, 99, 99.
Okay, very good. I don't feel anything there. Okay. I'm going to go ahead and percuss all the way across here, systematically. We're checking for the symmetry of the lung sounds. We're also going to do the lateral aspects. Any dullness would indicate some fluid or something going on in there, okay? You're going to go ahead and listen here. And can you breathe in big and deep? Okay. Okay. And I don't hear any adventitious lung sounds. There's no wheezing. There's no crackles. I'm going to do the lateral side. Okay. Very good. All right. Very good. All right. We're going to look at the diaphragm now. If you can even bend forward a little bit. I just want the, actually, can you swing that way? That way. Legs that way. Okay. Very good. All right. I'm going to go on the 10th rib, and if you could just breathe in and out. Okay. And again. And I'm looking for the symmetry of the movement back and forth, and it's very good. Go ahead and do it one more time. Okay. Good. So your the diaphragmatic expansion is even. Okay, we're going to do the excursion now, and I'm going to percuss your back, okay? So if you could take a big deep breath and hold it. Okay, I'm going to make a mark here. Oh, let's do it again, Jess. Sorry, big deep breath. Okay. And breathe. Okay, and then if you can blow your breath all the way out and hold it. Okay, very good. And you can breathe. And we're going to measure, and it is about 3 centimeters, and that is perfectly good. That's how much your diaphragm raises up and down, okay? All right, I'm going to go ahead and look at the front, if you can. Oh, yeah, okay. Going to look at the skin again, looking to see if there's any deformities. I don't see anything. The skin is all good. I don't see any lesions, no moles, nothing of that sort. Your respiratory effort is good and unlabored. I don't see any coastal retractions at all. Okay? I'm going to go ahead and palpate your chest. Tell me if you feel anything that's sore. Okay. Anything there? No?
No.
Okay. I'm also looking for any pulsations or heavings on your chest for your heart, okay? I'm going to put my hand here and we're going to feel over, it's called the precordium, where your heart is. I don't feel anything. And I'm going to try to find the API, the apical impulse. And it should be on the mid-clavicular line there, your 5th rib. Okay? I'm going to go ahead and percuss across, all right? And it all sounds nice and symmetrical from side to side and on the lateral aspects. Okay, very good. I'm going to go ahead and auscultate. Can you breathe in and out for me? Okay. Okay. Very good. Okay. And this side. Okay. Very good. And we're comparing side to side, making sure that there's nothing amiss. Can you go ahead and say 99 for me?
99, 99, 99, 99.
Okay, very good. And that's checking for the tactile firmness again. Okay. Going to go ahead and listen to your heart sounds now. And we're going to start off with your pulmonic. And that is the second rib, intercostal space, on the right sternal border. And this is the, or that was the aortic, sorry. This is the pulmonic. This is the on the left side. And then Erb's point is one down. And then the tricuspid is one more down on the fourth. And then the apical or the mitral is the fifth, oops, I'm sorry, honey, fifth intercostal rib right in the mid-clavicular line. And it all sounds very good. It's all nice and even. Okay, I'm going to go on, move to your abdomen. If you can go ahead and lay down. I'm going to shine my light and look at your skin, looking for any movements, any pulsations, anything that looks odd, or if I can see your aortic. And the skin is nice, good skin distribution. I don't see any lesions, nothing amiss there. I'm going to go ahead and listen, okay, to the all four quads. And we're listening for the consistency, that things are moving in there, that it doesn't sound hypo or hyperactive or tympanic or anything like that. And it all sounds very good. Okay, I'm going to go ahead and percuss across. Noting the change in tone. Let's just make that one go here. There you go. Okay. I'm going to go ahead and check for the liver. I'm going to measure the liver border. Okay. I'll mark where I hear the difference in the tone, and I'm going to go up and mark there. Okay. And we're going to measure this, and it is 5 centimeters. Okay, so that's a little less than what it should be normally. It should be like 6 to 12, but it's perfect anyway. And we're checking the spleen now, percussing for any dullness, and it all sounds resonant. Any dullness would indicate an issue there too, okay? We'll go ahead and do some light palpation. You tell me if you feel any tenderness, anything like that, okay? Okay?
Yeah.
Everything feel good? Okay. I'm going to do some deep palpation now, and this is for the liver, the spleen, and the, sorry, the left kidney and the right kidney. Okay. And then the aortic pulsation. Very good. I'm going to go ahead and listen to your arteries there too. I'm going to listen to the aorta. Things are really moving now. And the iliac, the left and the right. And the renal, left and right. And then the femoral. And there again, I'm listening for any abnormalities in side to side, if there was any blood flow issues. Okay? Everything sounds very good. Okay, I'm going to go ahead and we'll set you up here. We'll look at your feet and your legs now. Okay? Your legs themselves look nice and toned. The skin is all symmetrical. There's no lesions, rashes, anything like that. Your cap refill on your toes, bilateral, is brisk. I don't know if you wanted to make it move down a little bit. And I don't see any edema. There's nothing abnormal. Sensation-wise, can you shut your eyes and tell me if it's sharp? Sharp, dull, sharp, dull, dull, sharp. Very good. And that's all intact. I'm going to look at your muscle strength. Go ahead and push up and down, and then back and forward. Very good. And the muscle strength is good and strong. I'm going to palpate your pulses. I know you're ticklish, I'm sorry. This is a popliteal. They can't see it. Make it move down. Push it down. There you go. And then the post-tibial. And the dorsalis pedis. And we're going to do both sides, making sure it's all even. And the popliteal. And the post-tibial. And the dorsalis pedis. Okay, very good. All right, we're going to go ahead and look at your reflexes now. Can you slide up a little bit more? Okay, we're going to check your popliteal reflex. Are you dangling? Dangle. There you go. Okay. There we go. Got that moving. Okay. Good. Sorry. There. Okay. That was good. All right. We're going to do your brachial radial too. Okay. Okay. Very good. And one thing I forgot to do is I forgot to palpate your axillary and your other nodes. So this is your axillary nodes, making sure that there's no lymphadenopathy in there, okay? I know, you don't like that. You're so ticklish. Okay, and then your infraclavicular too. And I don't feel anything there, that's all very well and good. Okay, so lower extremities are good, there's good muscle tone, everything's intact. Can you go ahead and stand up? And we're going to look at your cervical area here. I'm going to just palpate. First of all, just go ahead and relax here. So I'm checking to make sure that there's no tenderness, there's no deformities in your cervical area, and your thoracic, and your lumbar. Any pain?
No.
Okay, now go ahead and bend over. And I'm looking for symmetry, making sure that it's all equal, that one side's not cocked, that the hips are nice and symmetrical, and the spine itself is nice and straight. Okay. I think that concludes. You're a very healthy young woman. Thank you very much for helping me again. I appreciate it.
No problem.
And that concludes my head still. Thank you.